All right, in this video, we are going to talk about the concept of transparency, which is very important in healthcare interpreting. And it is a concept that you need to be very familiar with, and it is going to tie to a lot of the things that we have already talked about, like accuracy and completeness, as well as autonomy. After we discuss transparency, we're also going to talk a little bit about the pre-encounter. But let us start with transparency. As you see my slide here, transparency is very important for accuracy and completeness. It is very important for direct communication, and it is very important for autonomy. So transparency basically means that when an interpreter is present, and because the interpreter has access to all of the communication, so that means because she speaks both of these languages, she doesn't have many barriers to communication. The interpreter is actually there to break down barriers of communication between the other two folks. So that means that the interpreter has access to all of the communication that happens within the encounter, because she can understand the English speaker and she can understand the Mandarin speaker. So nothing is hidden from the interpreter. For the Mandarin speaker, things that are said in English could be hidden if the interpreter doesn't interpret them. And the same is for the English speaker. If something is said by the patient in Mandarin, it can remain hidden from the English speaker because they don't speak Mandarin. So the interpreter's job is to ensure transparency, to ensure that nothing is hidden, nothing that is said, none of the information that is given in an encounter is hidden from anyone in the encounter. And so the only way that happens is if the interpreter ensures transparency and makes sure that everything that is said gets through. So accuracy is very important, as well as completeness, to be sure that everything gets through. As of course are skills to be able to be accurate. Now, with transparency, the other thing that is very important is that the interpreter remembers that they have to interpret everything, even if they are uncomfortable with it, even if they don't agree with what is being said. Because if they choose to leave something out for either of those reasons, that means they are not being transparent. That also means that they are choosing what a person can and cannot hear. In that case, the interpreter is taking away the person's autonomy by choosing what this person has access to and what they don't have access to. Transparency also allows for direct communication and access that allows a provider to truly be able to understand the patient's needs and concerns as the patient is explaining them. And now that's something that's very important, for the doctor to be able to hear exactly how the patient is describing something, the terms that they are using, the explanations that they are giving, and the words that they are using to give those explanations are very important, because this is going to help the doctor evaluate how they can best communicate with the patient, regardless of language barrier. But what is the best way to give this patient information based on how they express themselves? So is this going to be a patient that perhaps needs to meet with somebody one-on-one to give an explanation? Is this going to be a person that I don't need to have them meet with someone one-on-one? I can give a brief explanation to them here in the office because they seem to understand medical concepts easily. Or is this someone that I can give something in writing and without having, again, to set them up with a one-on-one training? And even make a determination whether giving this person something in writing might be beneficial or not. I'm going to give you an example here so that you can see what I'm talking about. So think about these two people. The first person who perhaps says this to the doctor: I asked for an appointment because I have been experiencing polydipsia and polyuria, sometimes having to empty my bladder 10 to 12 times a day. I don't have pain with urination, so I don't believe I have a UTI. I have also gained a lot of weight due to polyphagia. I wanted to ask you to please order some labs to check my blood glucose levels. I have not seen a provider in a long time. I believe it has been over 2 years since I last saw one, when I presented with pain in my epigastric region. Now, if a patient talks to a doctor like this, then the doctor is going to, and I think all of us are going to feel that this person does have a good understanding of medical terminology. And so the words that we're going to use to communicate with this person, we're going to try to meet them at their same level and start using some of medical terminology to match their conversation. The other thing that we might do in this case, that a provider might do, is again figure out that if there is any follow-up or specific instructions that the patient needs to follow, because they seem to have a good understanding of medical concepts, it might be okay to give them their instructions orally, knowing that they are going to be able to understand them because they have some background. Now, the problem starts when the patient doesn't express themselves using these terms, but the interpreter does. And so all of you, in order to earn the HCI degree from American River College, have been asked to also take a medical terminology course and an introduction to anatomy and physiology. And so you will be familiar with a lot of these terms. And so what happens sometimes is that interpreters want to start using this terminology because they know it. And then they begin to move away from matching the register that the patient is using. And so what they are doing is they are becoming a barrier to the provider to be able to directly communicate with their patient and to get that information that the doctor could have had if they were able to actually listen to how the patient speaks. And so in the previous modules, we've talked about different types of meta communication and para communication, paralanguage, and we have looked at the different things also carry meaning. So we looked at body language, we looked at facial expressions, and we said that these things also are very important and they carry meaning if I am using medical terminology, such as you heard me say, to describe things like polydipsia, polyuria, and things like that, then I am communicating to the person that I am knowledgeable about healthcare and medical concepts. Now, if the patient is not using that language and the interpreter is using that language to interpret, then what the interpreter is doing is she is adding to that message, adding that meaning that comes with using medical terminology. We are no longer accurate. We are also now becoming a barrier for direct communication because we are not transparent. We are blocking the provider from seeing the communication entirely. So now I want you to take a look at this slide one more time, and we're going to take a look here on the left side because I want to be sure that we understand that we don't interpret word for word. And so what I'm saying here is not that the interpreter should have interpreted word for word. That's not what I'm saying. What I'm saying is that the interpreter should have used the same register, the same level of language. So let's take a look at both of these paragraphs, we're going to say that this part here, this is the original, this is how the patient said it, and this is how the interpreter interpreted it. And so anything that is in black, even though it doesn't use the exact same words, it's still okay to use because it is in the same register. It is in the same level of language. Anything that is in red is not okay because even though the meaning is the same, the register has been changed. So I came to see you because I have been thirsty and have been having to go pee. So let's take a look at the first part of the sentence. I came to see you because. Would it be okay for the interpreter to say, I asked for an appointment because? It might be. So if the patient has an appointment, is in a clinic, then I came to see you and I asked for an appointment because could mean the same thing. So even though we're not using the exact same words, that would be fine. Where it's not fine is where the patient says, I have been very thirsty and have been having to go pee. And the interpreter says it as, I have been experiencing polydipsia and polyuria. That's where, again, even though polydipsia means that you are very thirsty, and even though polyuria means that you have had to go pee a lot of times, the registers don't match. Okay. And as a matter of fact, even the words to go pee, the patient has said to go pee, but the interpreter has said having to empty my bladder. So again, how do you empty your bladder? You go pee. Those things do mean the same thing, but the register is not the same. The next sentence is, it doesn't hurt when I pee, so I don't think I have an infection. And the interpreter has said it, I don't have pain with urination, so I don't believe I have a UTI. Now, in this case, it doesn't hurt when I pee. And if the interpreter says, I don't have pain with urination, that's a little bit on the edge, but I've left it black because in English, urination is not very high level. Even if you don't know a lot of medical terminology, you could still possibly use the word urination. Is ubiquitous enough. So I've left it okay. I'm being generous. But what is not okay is when the patient says, I don't have an infection. I don't think I have an infection. And the interpreter says, I don't believe I have a UTI. And this is, again, something that we are changing the register. We're using a medical acronym in this case. The other thing that is happening here is that the patient hasn't said what kind of infection. Patient hasn't said, I don't think I have this specific type of infection. The patient has just said, I don't think I have an infection. And then the interpreter has added, I don't think I have a urinary tract infection. And it's probably because the interpreter is adding her knowledge of, well, if the patient is talking about urination and not having pain with urination, then that is most likely going to be related to a urinary tract infection. And so probably what this patient is saying is that they don't have a UTI. And so I'm going to add this here because it's very likely. However, again, that is still an addition. And we are also, again, changing the register. I have also gained so much weight because I'm constantly hungry. The interpreter has said, I have also gained a lot of weight. That's okay. So I have also gained so much weight. And if the interpreter says, I have also gained a lot of weight, that's fine. Again, it's not the exact same words, but they mean the exact same thing and they are within the register. Where we don't agree with is because I'm constantly hungry. And the interpreter has said, due to polyphagia. And so polyphagia is an increase in appetite. And so, again, they mean the same thing, but it's not the same register. I wanted to ask you to please do some tests to check my sugar and blood. The interpreter says that I wanted to ask you to please order some labs to check my blood glucose levels. So here, again, I'm being a little bit lenient. The patient has said, I wanted to ask you to please do some tests to check my sugar and blood. The interpreter says, I wanted to ask you to please order some labs to check my blood. I wanted to ask you to do some tests versus I wanted to ask you to order some labs. That's okay. I would let that one slide because labs and tests tend to mean the same thing. And again, labs in English with tests, those are words that are pretty ubiquitous. You don't necessarily have to have a lot of medical knowledge to call it that. So I would let this one slide. But where I don't agree with is where the patient says to check my sugar and blood for two reasons. First of all, because the patient has said to check my sugar, and we know that the way that we check sugar is through blood glucose levels. But now the interpreter has sort of confused themselves and combined two tests in one. A blood glucose level test is one test, but if you look over here, the patient has actually asked to check my sugar and my blood. So the way that the patient has phrased it, it actually means two things. And now the interpreter, because she's trying to use her medical terminology, can actually become confused. And in this case, is now causing her to omit something. And so then the next sentence is, because I haven't seen a doctor in a long time. And the interpreter says, I have not seen a provider in a long time. Now, again, this is going to be one of those things that a lot of times we will refer to doctors as providers, but provider is a very general term. Provider can be anyone who provides healthcare services to patients. So this can be a doctor, but it can also be a nurse. It could be a social worker. It could be a CNA. It can be respiratory therapist. It could be occupational therapist. It can be a physical therapist. So it can be any kind of healthcare provider. The patient hasn't said that they have not seen other providers. They said, I have not seen a doctor, but the interpreter has changed it to provider. And so that term is way too general, where the interpreter is being way too general by using the term provider, even though the patient was specific to say, I have not seen a doctor. The next sentence is, I think it's been more than 2 years since I saw a doctor because I had pain here high up on my belly. And the interpreter says, I believe it has been over 2 years. That's the same. I think it's been more than 2 years. That's fine. Not the same words, but the exact same thing in the same register. Where we have a problem is where the patient has said, I had pain here high up on my belly, and the interpreter says, I presented with pain in my epigastric region. So I hope this example helps you to clearly see why it's important that a provider have true access to patients and how not matching a register can impede that. Let's now take a look at how transparency is accomplished, how we can achieve transparency. What are the things that we can do to be sure that we are being transparent while we are interpreting? So the first thing is a professional introduction. And the professional introduction is a really good example of being transparent because it tells everyone what is going to happen what the interpreter is going to be doing during the encounter, but it also lets everyone know that the interpreter is going to be transparent. And importantly, it lets everyone know that the interpreter has to be transparent. Okay, so let's take a look at that pre-session, or as I mentioned, it is also referred to as professional introduction. So we're going to take a look at what it is that we let everyone know. That's anyone who is going to participate in the encounter, so the patient and the provider. This is what we let everyone know before we get started. First, we let the patient and the provider know that they should speak to one another, speak directly to each other, focusing words and their vision towards each other and not you, the interpreter. We also ask them to speak in short phrases when possible. And again, this is us being transparent and saying, we need to remember everything. We need to memorize everything that you are saying. So we are going to keep it real and ask you to use short phrases when possible so that we may do that. The next thing, number 3 there says using the first person. So we are going to ask them to use the first person as if you were not there. So, for example, what this means is telling the patient and the provider that when they are speaking to one another, do not say, tell her I want her to come back in 2 weeks. Instead, saying, I would like you to come back in 2 weeks. So talking directly to the patient in this case, as if there was no interpreter. And the same thing with the patient. So we're going to ask them to do that, and then we're going to let them know that we will be speaking in that way. So we are not going to say, the doctor would like you to come back in 2 weeks. We're going to let them know that we are going to be speaking in the first person, even though we are not the ones who are saying these things, so that in this way, they understand that even though you are using the first person, the communication is coming from the other party and not from you. This part is very important. We're going to ask everyone, again, we're going to be transparent and let them know that we are going to interpret everything in an effort to be transparent. And so we're going to ask them to remember that if there is something that they don't want the other person to hear, they should not say it, because if it is said, it will be interpreted. And then, of course, we also want to remind the patients mostly, not so much the providers, because the providers know that if you are working in healthcare, they know and they expect you to know that you must abide by HIPAA and the privacy rules. But the patient may not know that. So you will let the patient know when you are doing this professional introduction with them that you are going to keep anything that is learned, any information that you hear or see in the encounter is going to be kept confidential. So this professional introduction sets the stage for transparency. It lets everyone know what's going to happen, how it's going to happen, gets everyone in the loop. So this is the first step to being transparent. Now, the next thing that we do as interpreters to make sure that we are transparent is we ensure accuracy and completeness while we are interpreting. Now, sometimes you need a little bit more support in order to interpret something accurately and completely. And what I mean by that, you see here that I say that you are going to be accurate and complete while interpreting and while mediating. What I mean is that sometimes interpreters need something repeated or they need something explained. So if a doctor goes on for a very long time, and actually let's use this example here. Let's say that the patient started talking and didn't give you a break at all when they were saying all of this. And you have a good memory, you were taking notes, but you know that you missed something. And so you need to ask the patient to repeat something. So let's say that we were able to interpret all of this. The interpreter is able to interpret everything except the last part. So the interpreter says, in the first person, I came to see you because I have been very thirsty and I have been having to go pee 10, even 12 times a day. It doesn't hurt when I pee, so I don't think I have an infection. I've also gained so much weight because I'm constantly hungry. I wanted to ask you to please do some tests to check my sugar and blood because I haven't seen a doctor in a long time. I think it's been more than 2 years since I saw a doctor. And so the interpreter says, okay, I remember all of that, but I know the patient mentioned why they saw a doctor 2 years ago, but I don't remember. So because the interpreter has to be accurate and complete, the interpreter in this case should ask the patient to repeat that information. Now, you're not going to ask them to repeat everything, right? So what you're going to do is you're going to ask them to repeat exactly what you know that you're missing, what you think you're missing. And so because you have been interpreting in the first person and everything that the doctor has said to the patient, you have said in the first person, you need to make it clear that the person who is asking for this repetition is the interpreter. That's part of being transparent. So where the information is coming from is very important. So you already told the patient that when you are interpreting, you will be using I, and that means that the doctor is speaking. So you told them, even though I'm going to be saying I, the information is not coming from me, the interpreter, it's coming from the doctor. Well, now you need to let the patient know where this request for repetition is coming from. And so you can't use I because it is not coming from the doctor and you had been using I for the doctor. So now you need to ask for this repetition in the third person. First, you're going to interpret for the doctor everything that you do remember. And then before they have a chance to respond, you're going to address the patient and ask for that repetition. And it would sound something like this. As the interpreter, I would like to ask you to repeat the reason why you saw a doctor 2 years ago. And so now you have let the patient know that the interpreter, as the interpreter, you're asking this question. And so now what has happened is you are having a conversation with the patient that is blocked for the doctor because the doctor doesn't speak Mandarin, right? In this case. Now, I know I said it in English, but pretend I said it in Mandarin. So now you are having this conversation with the patient that is blocked from the doctor because they don't understand the language that you and the patient understand. So in order to ensure transparency, what you'll have to now do is let the doctor know what that conversation was about. So now to the doctor, this is what it would sound like. As the interpreter, I had to ask the patient to repeat the reason why she had seen a doctor 2 years ago, because she did mention it the first time. She said that the reason why she saw a doctor 2 years ago was for pain high up on her belly. And so now everyone knows, you made sure that everyone knew what was said. And you did that even though you needed something repeated, right? So you asked for a repetition to be sure that you were accurate and complete. And then you also did that by letting everyone know who said what. And anything that was said in English was said in Mandarin, and everything that was said in Mandarin was said in English. So now what you do from there is you go back to interpreting. You are done informing everyone. Now you remain quiet because no one has said anything and you have nothing else to interpret. and then the doctor most likely will resume and ask more questions or ask follow-up questions from all of the information that the patient has given her, and you will then resume interpreting like you had been interpreting up to that point. And then, of course, matching register, which I explained previously, is another thing that you have to do in order to ensure transparency. So, your professional introduction, being accurate and complete when interpreting and when mediating, using your protocols, and matching register. Here's a very important thing that I want you to remember that you might see on an exam, and that is that if an interpreter is not transparent, then an interpreter is not accurate. So there is no accuracy without transparency. Also, if you're not matching register, then you're not being transparent, and again, you are not being accurate because you are missing that information, right? You're not complete because you're missing that information that comes from being able to listen to the type of words, the terminology, and the style of speaking with someone. All of those things carry meaning, and if you are not matching register, then you are not completely allowing the person who is listening to the speaker to have that information that comes with those nonverbal communication cues. Okay, so let's shift gears to the pre-encounter. And you see here that this is where HIPAA begins. So in the pre-encounters, when you start receiving information that is protected information, that is PHI. So during the pre-encounter is when you will receive information about where you need to go, the name of the patient. Oftentimes you will receive medical record number as well as the name of the provider who is going to be seeing the patient and the name of the organization that the provider works for. And so all of those things, patient name, medical record number, location, address, and department, and a patient medical record, those are things that you will most likely need in order to get to your assignment. And then once at the assignment location, identify the client or patient you will be working with. And so all of those things are protected information. So part of your pre-encounter is to receive this information to make sure that once it has been transmitted to you, that you take whatever steps are necessary to keep it private and protected. Now, in preparation, the other thing that you're going to do is you're going to take a look at your schedule, take a look at where this assignment is, take a look at the assignment before, the assignment after, and if you have to travel because it is in a different clinic, in a different location, because you are not a staff interpreter, you are an interpreter who contracts with or works for an LSP, and you are sent to different clients, to different providers, then you have to take a look at your travel time to be sure that you are able to arrive on time. Arriving on time is very important in healthcare. It is very, very important. It's not only very important in healthcare, but it's also very important in the American culture. And because we are interpreting, we are working within the American culture, we have to be mindful of that and respectful of that. So these are things that are very important. So then you'll also take a look at how you will get to your assignment. If you're staff, you're not traveling, no worries. But if you are not staff, what does parking look like? You have to consider the fact that you cannot just step back into the room where the patient will be. You will have to check in with registration. Consider things like accessing buildings before the encounter begins. So again, part of the pre-encounter. And then you're going to look at what do you know about the topic. Do I need dictionaries? How can I prepare? Now, unfortunately, it would be very, very nice if when we received information about an assignment, we could also get information that gives us a little bit of a background about the patient. So it would be nice if, for example, someone said the appointment is at Women's Health. You're going to be working with a patient who recently had a baby. So that would mean that you can sort of narrow down and study, get ready for a postnatal appointment. And you can do some research and take a look at what kinds of things are discussed with a brand new mom. But unfortunately, the information that you will get is not going to be that specific. The reason for that is because of HIPAA. So you do not get that exact information, but you do get some information that gives you a bit of a lead, and that is the department. For example, if we were told that it was at Women's Health, we could start preparing and refreshing with vocabulary that has to do with a woman's anatomy. We could also start preparing with terms that have to do with common topics at a women's health appointment. We could also start preparing, for example, menstrual periods, methods of birth control, and pregnancy. So while we may not get specific information, we can still get some information that might be useful.